Yes, I think they really like it. Okay, I want to tell you a little bit more about this interesting story. It's a disease that destroys the mind and is very difficult for family members to cope with too. But for the first time now in 27 years, there might be some new information on Alzheimer's disease.
New guidelines are being released for diagnosing it, and Fox 9's Jeff Goldberg is here. So Jeff, the doctors say it can be detected now even before there are symptoms?
Yeah, that's really what they're getting at, Jeff. And what they're hoping these new guidelines can lead to, of course, is early diagnosis. Between the Mayo Clinic and the U of M, there is groundbreaking work happening in Minnesota to fight this disease. And everyone who is part of that fight just got a big boost. Just ask two people who work with Alzheimer's every day.
To me, this is a very big deal.
And you realize this is no small development.
So this is really groundbreaking.
Michelle Barclay is with the Alzheimer's Association of Minnesota. The illness affects 100,000 people in the state, 5.4 million nationwide.
It starts very subtly with memory changes. It impairs people's ability to work, to drive a car.
But Michelle sees hope in the new guidelines for diagnosing the disease, the first of their kind in 30 years. She calls it a huge step towards effective treatment.
We need to get to the point where we can identify this disease before the symptoms start.
The guidelines would divide the disease into 3 stages: a phase when dementia has developed, a middle phase when mind problems emerge, and the most recent phase in which symptoms are not evident but changes are happening in the brain.
And what we're thinking about now for the first time is what leads up to it.
Dr.Richard is a neurologist at Abbott Northwestern. He says the new guidelines can help look for indicators through brain scans and fluid tests that a person is likely to develop dementia, like cholesterol and blood pressure can be indicators for heart disease. Find the indicators early, start treatment early.
You can't take Lipitor or cholesterol medications at the time of your heart attack and expect it to take care of your heart attack. It just won't do it. And that's what we've been doing with Alzheimer's disease, is we've been using these drugs way at the end when there's just not a really big hope of having them help.
And if changing that trend means Michelle has to find new work, all the better.
Well, I think it would be a miracle for these people, and I think it would put us out of a job, which is what we're working for every day.
Now, despite the new guidelines, doctors are not yet being advised to change evaluation or treatment. Some of those so-called indicators that can possibly detect Alzheimer's are still new and cannot definitively determine whether or not a patient has the disease. Jeff Goldberg, Fox 9 News.
Stay in school.